Hi, my name is Leslie. I'm going to be your nurse today. So anytime we come into a patient's room, we always want to introduce ourselves to patient identifiers, give the patient privacy. We're going to raise the bed to a working level, GPSP, and we're going to gather supplies and always do hand hygiene. So today we're going to determine if the patient needs suctioning of their trach. So first things first, we always want to do a respiratory assessment. We're going to look at their O2 saturation, their respirations, depth rate, effort. We're going to look at the symmetry of the patient and seeing if they're using accessory muscles. We're then going to lift them up. We're going to look at their back, listen, and feel. I'm just going to look around, see there's no masses. I want to listen. And once we listen, we're just going to take a feel and make sure there's no masses, lesions. We're also going to make sure their skin is intact. And we're going to put our thumbs back here. We're going to have them take a deep breath in and out. Make sure our hands are expanding out for chest expansion. Everything looks normal. We'll lower them back. Do the same thing in the front. We're going to take a look, make sure there's nothing abnormal. I want to take a listen and then feel. And then just go to feel, make sure again, no lesions, masses. And after doing a respiratory assessment, the patient is a little bit congested, so we're going to go ahead and suction their trach. So we want to do a pain assessment on them, make sure they're not in any pain. If they are, we're going to do pain meds 30 minutes prior. Right now the patient denies pain, so we're going to go ahead and continue with suction. So we want to do hand hygiene. We're going to go ahead and drape the patient with a cloth just in case any secretions come out while we're doing trach care or suctioning. Then I want to check the suctioning, make sure it's working. For an adult, you don't want to go beyond 150, for a child 125, and for a newborn 100. So we're going to do another round of hand hygiene. We're going to go ahead and apply goggles and a mask. And then we're going to go ahead and set up our sterile supplies. To lip and then put in some sterile saline. And then we're going to apply sterile gloves. Before we do that, we want to do another round of hand hygiene. Move that out of the way. We're going to go ahead and grab our catheter. So with our non-dominant hand, we're going to go ahead and plug this into suctioning. So this hand is no longer sterile. I'm going to insert this. going to make sure the suctioning is working, holding our thumb down. Works okay. And before we get started, we're going to hyperoxygenate the patient with our non-sterile hand. You want to do this 3 times. Anytime we're doing suctioning, we always want to do no more than 3 passes and 3 hyperoxygenation each time. We're going to go ahead and insert the suctioning into the trach until we have cough, resistance, or a patient gags. We want to make sure while we're inserting we're not suctioning. We'll go ahead and insert. Once we feel resistance, we're going to go ahead and suction intermittently, doing a back and forth motion while pulling out. Again, you don't want to do this no more than 10 to 15 seconds each pass, but between each you can give the patient oxygenation for 30 to 60 seconds, but you don't want to do this no more than 3 times. So once we are finished doing suctioning, we're going to go ahead and remove supplies, dispose of that. We would do a round of hand hygiene, and then we are going to go ahead and reassess the patient's respiratory status, making sure we're checking for the rate, effort, the O2 saturation, lung sounds, make sure they're still not congested. So we're going to go ahead, again, look at their symmetry, O2, their respirations, depth, make sure all that looks okay. We're going to sit them back up. Go ahead and have them take another deep breath, make sure their chest expansion is still okay. And we're going to do the same thing for the front. We're going to inspect again. We're going to listen and feel.
Oh, I guess you can touch the inside because you have stress on it.
The patient sounds much more clear after doing suctioning. So once we finish that procedure, we also again want to reassess for pain, make sure they're not in any pain after doing procedure. We want to lower the bed back down, make sure the patient is comfortable, give them a call light, and document and report.